Dr. James Helliwell, our guest. He's an anesthesiologist, president of the BC Anesthesiologists Society, works out of St. Paul's mostly.
That's correct, yes.
Teaching hospital, St. Paul's?
It is a teaching hospital. So I'm a clinical assistant professor there. I have a lot to do with residency education, teaching all the residents, and also in the selection process, which is a committee that I've chaired for a few years, selecting the medical students who want to become anesthesiologists.
Okay. Now, rumor has it we have a shortage of anesthesiologists in BC, or a near shortage. Why?
It's a really complex issue, and it's been brewing for about a decade. And we've been talking about it for a decade, and to be honest, not getting a lot of people listening to us. And people don't tend to listen until there's a real problem. In other words, operating rooms are closed. So there's a few different factors that are happening. One is we have the same demographic as everybody else has, which is that our population's getting older. Our average age of anesthesiologists in BC now is 52 years old. We have more people over the age of 50 practicing than under the age of 50. And you're starting to see that in quite a few medical specialties. But what makes us different than everybody else is normally there's a nice distribution curve. You know, it looks like a nice little circle for age.
Right.
And we have a chunk missing that looks like a little V. And that little chunk missing is all our young people. And they're leaving British Columbia.
Because?
Conditions are better, work hours, work life, cost of living, and the ability to find a job that meets their needs is better for them and easier for them in other provinces.
So they're trained anesthesiologists, but they're
Yes.
saying, I make a higher wage in Manitoba.
Yeah.
Or are they going south too?
Some are going south, most are going across Canada. There's a fair number of jobs across Canada. Our shortage is far worse than anywhere else in Canada because we don't train enough in British Columbia. So we train 10 people a year to become anesthesiologists. And that doesn't come close to meeting our needs.
No.
So we've always relied on other people coming from other provinces. And that's always worked until the last 5, 6, 7 years, where that started to really decline, and now we don't get anybody.
Really? So the lure of the ocean and the mountains and, skiing at Whistler is not working?
It's not working. It's not enough.
And in some hospitals or in some provinces, as you know, they have dedicated obstetric anesthesiologists, which means they only do moms and babies, I'm assuming.
Moms and babies, yes.
Why not here?
Well, here it's been an issue that I think that we've all agreed that it's what patients need. It's the highest level of safety for mom and for baby, and it exists all across Canada with the exception of British Columbia. BC Women's Hospital has that because that's all they do, so they're dedicated to that. But at other hospitals like Surrey, Royal Columbian, I think that the government and the health authorities agree that that's a service that's required, but it comes back to the shortage issue. We're not able to get those people to come here. So they were looking for 10 people to do that job in Fraser Health about a year and a half ago.
Right.
And they advertised all across the country. They sent a letter personally to every single anesthesiologist in Canada who had their certification. They had not one applicant, not one person expressed interest in any of those 10 jobs.
So do you have to have more training to be an obstetric anesthesiologist, or is it just the same training? It's just that the hospitals are too busy and they need you to be able to be there for a cesarean section or for a knee replacement or a heart operation.
That's right. It's that the hospitals are too busy. It's that there's a lot of moms needing care and needing it quickly. And there's also a lot of other operations going on. And so we only have so many people. And one of the issues is that our people are working really, really hard. The average work week of an anesthesiologist in BC is 72 hours. That's the average. So there's people working 90, 100, and that tends to be my average work week. So when you're trying to encourage young people to come here, so we have quite a few people who work part-time. So we call them part-time. Their average work week is 55 hours.
That's a lot.
So that's a lot. And so we don't have the people to fill these positions. And the certified people that we're looking for are choosing not to come to British Columbia.
Right, and you do not want your anesthetist sleepy.
No, you don't want your anesthetist sleepy.
That would not be good.
That's right.
But what if you have an emergency C-section, not an elective C-section, emergency C-section? I assume it could be a life-death situation for baby and for mom.
That's right. So, it's a matter of seconds to minutes for both baby and mom to be able to get them into the operating room. So it requires, again, that team. That obstetrician needs to recognize the problem, call us, and get that patient into the operating room quickly. We need to get them anesthetized to get the baby out very, very quickly. Requires a special kind of anesthetic that takes into account both mom and baby. And then often we're needing to sort of help the pediatrician a little bit, look after baby as well after baby's out.
So if a female, and I'm trying to help from all sides here, if a female can have a natural birth, I'm assuming it would just be better for everyone.
Yeah, absolutely. I mean, we don't want to be involved unless women want us involved. So the problem is for those patients where there's a need to have an anesthesiologist involved at the discretion of the obstetrician and the patient as well, both for pain relief as well as also for cesarean sections.
Okay, and if you're having your first baby and you thought you were going to do it all naturally, and then about that labor started and you thought, maybe I need a little help from a drug or two.
Yeah.
That brings in the anesthesiologist always for a
yeah.
spinal or some other form of...
That's right. We usually use something called an epidural, which is very similar to a spinal, just goes in a different space. And we leave a little catheter in and provides great pain relief, doesn't go into the bloodstream to affect baby.
Okay.
Makes moms comfy.
So do you see a Minister of Health who gets this at this point in this province? Falcon was the Minister of Health, then he ran, and then Colin Hanson, Finance Minister, was the Minister of Health.
Yeah.
Not sure what's happening now.
Yeah.
But what would you say to the Minister of Health? What is needed at an anesthesiologist level?
Well, what we really need to do is to take a really close look at the system that we have for how we use our anesthesiologists, how we fund our anesthesiologists, and how we recruit anesthesiologists. And what we need to do, I mean, we have an incredible amount that we can do to make the system better, but we need the people to do it. So what I would say is help us find the right people. And that doesn't mean someone from anywhere. That means somebody who is actually qualified and certified and has the level of quality of care that Canadians and British Columbians expect and that we get across the country.
Well, I'm certain if you don't have an anesthesiologist, the surgeon simply can't work.
That's right, and this has been a real problem. If you look last year, the shortage of anesthesiologists closed so many operating rooms that, and an operating room is incredibly expensive. I mean, you're talking a couple of $1,000s an hour. We spend $2 billion a year on operating rooms, not including paying the physicians. This is just to run those physical rooms and provide those cases. We lost so much that we spent about $100 million last year and delivered not one surgery with that $100 million. This month alone in March, we have over 150 operating rooms closed because there's no anesthesiologists.
Yeah.
And they're simply not there. They're all working 70, 80 hours a week.
Sure. And I'm sure that the emergency patients get priority. It would make sense.
They do, yeah. And you know, we all have relatives who are waiting for something. They're waiting for a hip. They're waiting for a knee. You know, they need some kind of surgery. And emergency patients will always take priority. And often we'll have a list that looks like something, but there's not enough of us to do that, plus all the emergencies, and those elective patients will wait. And that's incredibly traumatic for patients.
See, I always thought if you had a choice about choosing a surgeon, you should always ask the anesthesiologist, because you see surgeons work.
We do. We see them all day.
And you know who's really good at what they do, right?
Yeah.
And you think, I always thought first call should be to the anesthesiologist, because they're there and they watch and they know when things don't go quite right, and which surgeons are totally, not that most surgeons aren't capable, but some are a little better than others.
Yeah. Well, we're very lucky in BC that most of our surgeons, I have to say, are just very, very good. But you're right. We see it all intimately and up close every day.
I bet you do. Yeah. Are you off to work now?
I'm going to be off to work, and so normally I'm at work at about 6:15, and get home somewhere around 7:30, 8 o'clock at night if I'm lucky.
It's a long day.
And that's the problem, I think, and comes down to, you know, when you have anesthesiologists working 16, 18 hours a day, sometimes 36 hours in a row. I've had stretches where I've been at work for 72 hours.
Really? On call?
Just no break. It's just you're constantly going. And if you think about even things like a lunch, people often say to me, why don't you meet me for lunch? I say, I don't get to eat lunch. There is no lunch.
Right.
You may get 5 minutes between cases for lunch, but...
Right. And to think you could have been a lawyer.
And to think I could have been a lawyer. I started law school and left, I tell you.
You could have been a lawyer. What were you thinking? They get lunch, mostly?
They get lunch mostly, but they work very hard. But
Court takes a break. Nice to see you.
Very nice to see you. Thank you very much.
Dr. James Helliwell, President of the BC Anesthesiologists Society.